Thank you, Detlev, and I add my welcome to this year's meeting. So our first speaker is Professor Dr. Annette Grueters-Kieslich, who completed her medical studies at the Medical School of the Free University of Berlin and later her PhD at the same institution. She studied pediatrics, including perinatology, with a stint at UCLA in the US, and then was appointed to the faculty of the university. First as professor of pediatric endocrinology, and then since 2005, she has been the medical director of the Charité Center for Women and Children's Health and Human Genetics. In 2005, she was elected dean of the Charité University of Medicine. Dr. Annette.
Dear Minister of Health of the Federal Republic of Germany, Mr. Barr, dear Minister of Health of the Republic of Botswana, Mr. Segozing, dear Governing Mayor of Berlin, Mr. Wowereit, dear Mrs. Samar, distinguished delegates, dear colleagues, guests, and friends. This year, in my function as the Dean of the Charité, I have the privilege and the honor to welcome you on behalf of the Charité, as well as of the M8 Alliance, to the 4th World Health Summit here in Berlin. This event, the central platform of the M8 Alliance, will again bring together researchers, physicians, leading government officials, and representatives from industry as well as of non-governmental organizations and different healthcare systems. The M8 Alliance has been set up as an international network of medical schools and academic health centers to increase exchange between the members and to cooperate in the areas of research, education, and healthcare. The first health summit in 2009, like I would say all new activities, was regarded with great skepticism, at least locally here in Berlin. In light of the emerging financial crisis, it was felt that it was more urgent for the Charité to concentrate on dealing with its own problems instead of pretending that the M8 Alliance for Global Health had a high-level forum role equal to the role of the G8 and now G20 for global politics. But we felt, and we still feel, that the rising costs of healthcare, together with the demographic changes, indeed require a conscious international effort to maintain innovation in medicine, whilst still keeping it affordable and to ensure access to the general population. So we followed our mission with persistence and even some stubbornness, and the preceding 3 summits have proven that collaboration and open discussion is an important tool to define the common goals for improved research, education, and healthcare for a global perspective. Although health is a human right, we face a growing disparity in the delivery of excellent, innovative healthcare to the general population, not only from a global perspective, but also within nations, within countries, and even within cities. We know, for example, from the metropolitan area here in Berlin, that among men, there is a difference of more than 7 years in the overall life expectancy, depending on where they live in the city and what their social status is. And the socioeconomic panel just recently has shown that better health depends strongly on economic status. And this is observed despite a German healthcare system, which is still considered as one of the best in the world, especially in the terms of access to innovation and high-quality care, independent of social status and financial resources. We know that these health disparities have a multitude of reasons, which are very much dependent on the local economic and healthcare system conditions. But there are some reasons which are universally valid. And one prerequisite for health that I would like to mention is education. The demographic change in all parts of the world results in a rapidly rising burden of chronic diseases, and this is at best counteracted by a vigorous emphasis on educating the general population regarding prevention and retaining health from very early on, which means starting in pregnant women, for example, regarding counseling on nutrition, continuing to early childhood regarding media consumption and physical exercise, and on to senior citizens regarding the prevention of frailty and accidents. We all know that prevention is the best medicine that we can practice. At the same time, the education of medical students and physicians, as well as of other health professionals, needs dramatic changes, and medical schools and universities have to emphasize the social responsibilities and accountability of the health workforce. We can set realistic goals in order to secure investments for the development and the use of new technologies, medical advances, and healthcare delivery. And we need to build sustainable national and international public-private and public-public partnerships to limit the waste in human and financial resources in research and development. Millions of dollars and euros are spent on health innovations that fail up to live to their promises. And public health interventions are often implemented without the consideration of the issues of equal access and are not vigorously evaluated. We also need to remind our governments that health really is a basic human right and a public good, and that equal access is of utmost importance for social peace, but also for peace in general. So one of the focuses of this year's conference will be educating health professionals for the 21st century, because the health workforce crisis due to an insufficient number of trained specialized health professionals poses a challenge worldwide. Although much attention must be devoted to the workforce shortage, the quality and the mission of the health workforce is equally important. Yes, we as medical schools and academic health centers, yes, we can make a difference. By close collaboration in analyzing today's science and by extensively sharing international experience and debate, we will be able to define realistic goals and to propose joint actions. We know that these goals cannot be reached at once and that we need patience and endurance. This is not easy. It's not easy for M8 and it's not easy for G20. However, we have to stay focused, and what counts along this way are the first steps, even if they are small steps. For example, the focus on public health of the last World Health Summit has already resulted in an international joint cooperation between France and Germany. So for the opening ceremony of the 4th Health Summit, I think it is justified to declare that this international effort is not only timely due, but also has made already an impact, which will definitely grow in the future. And I wish you all a very interesting conference and exciting days in Berlin.